Thank you very much for accepting to be interviewed.
Oh, it's my pleasure. I thought it was going to be a really exciting thing.
I was seeing the number of Japan, and they are surprisingly low. Like 13,231 infected and 360 deaths. So my
Hmm.
question is this because of lack of testing or because it didn't arrive yet?
Exactly. Well, the government hasn't, had, um, come up with comprehensive testing system yet, and they haven't tested enough numbers. That is why it looks so low, right? We're expecting Tokyo Olympics, right? So the government didn't want to really, show big numbers right after they postponed.
Yeah.
So I think that is one of the reason. And the second, I don't know if this is true, but they explain that um, they don't want the healthcare system go down if all of a sudden, big number is discovered positive, then you know get the healthcare system get panicked. So the government tried to minimize the testing, and that's the second reason.
Because I also heard that there was a team of government experts and saying that if Japan doesn't take the measures, you will have,
Mm.
they say, like 400,000 deaths or whatever. So I suppose, are they doing now more, or after canceling the events?
Again, yes, they increased, but still, I'd say it's far from enough, because since we haven't taken tests, we don't have like uh, good data to study. And so we're like, if it's like, say, I'm not specialist, but I want to know what is going on in our country, and then I have to go through and read all the articles overseas, and they have some charts or graphs, and we're trying to adjust and see how many numbers of patients coronavirus positive are here in Japan. And some people say that you know we had a travelers like freely coming in and out until uh, beginning of April. So that means perhaps uh, you know big number of people have already infected. We never know though.
My
Mm.
question is also, because the death toll is almost quite low, not just now. Is it because they told
Mhm.
me that in the winter they started to wear masks and so on this
Mhm.
winter? Do you think this is a reason?
It could be. Now it's like from February to May, we have a lot of like allergy problems, like by the pollen, hay fever. So people are wearing a lot of many of us, but maybe 30% are wearing masks during those pollen seasons. But I don't know if that was the reason why we have lower.
So, Emika,
You
how is now the situation? Because I heard you have like if the people stay at home, but it's voluntary.
know.
So how does this work? Because how does it go? Do the people, do they stay at home, and do they avoid crowding and system? Because I think there is no official order to do like this.
Uh, yes, it is an order, but it doesn't have like force. Like it's hard. We weren't really staying home. Like right now, shops are open, and some like hair salons, barbers are still open. Only like movie theaters and Restaurants are closed because they have, I don't know, the social pressure. They feel the social pressure that they have to close it. But the business owners, that they're really worried about what's going to happen, after this, because the government haven't, come up with the solution when it comes to the, life, you know, life going incomes
So
and
you
stuff
this
like that.
it's so the people are not staying at home, as in for example, I think the government said that you should work from home and so on. Are they doing this or not?
Uh, they are doing it voluntarily, maybe 70%, or it depends on the area, but maybe where I am, in Yokohama, the stores are closed, but people are just, walking, and children are playing in the playgrounds. You could see normal life just going on. And some areas, people, like the shopping malls are closed, so you don't see many people around.
So,
So it is working, but it's not working really.
and why do you think it's because why do they do it? Because they saw China, they saw, in Asia how quick it was. Is it because of the fear of the economic impact, or why?
Yes, I think so. And maybe because we, like you mentioned, we still don't have enough data to analyze. So maybe people are not taking it seriously enough. That could be the reason too. And the second one is like, yeah, they don't know how to pay the bills next month. So they have, some people have no choice. They just have to keep going to work.
My question is, how is the health system? Do every person has health system, or only the one who can pay it?
Oh, you mean like the healthcare program for everybody?
Yeah.
Yes, we have. Like when you go to see a doctor, usually you pay 30% of the total, so the government covers the rest. And for the coronavirus, if you are positive after testing, I heard that the government will pay the everything.
Mm. But the thing is
But
that they are not testing enough, no?
no, no, they're not.
Yeah, yeah. And what the voluntary restriction, I wanted to ask, when you go out, do you wear gloves and mask and on the others, or do they don't take this measurement?
Oh yes, everybody wears masks. Usually they wear surgical masks. If you don't have, and then you wear, you cover your mouth with the scarves and some kind of like that. I would say almost everybody is wearing.
And
Shopkeepers, customers, everybody.
but it's almost open, no? It's the shops,
Yeah,
no?
yeah, that's the thing. You're just, wearing a mask. Maybe this is gonna work. Maybe this doesn't work. But anyway, yeah.
Yeah. And my curiosity was, because normally the houses were very small in Japan. So how do you do it if you are in normally the people who are working from home? You have three kids, for example. Normally, it's very. What solution do they have to work all at home?
It's so true. I think it's really stressful for parents. Yeah, like I don't know how they're doing, especially when their kids are younger. If their mom is having meeting, but they will just go around. Yes, and the thing is, working from home is not really. It wasn't common at all in Japan before coronavirus. So people are not so used to, and I don't know. People working from home are very few, I think.
Yeah, they told me this is, and the
Hmm.
schools are closed. The university, are they closed?
Yes, they are. Until second week of May, it is closed. That's what it says now, but it will, I think, it will go longer, perhaps. I would say like end of March, people were very optimistic about the situation because the government decided that the Olympic will be held next year. So people were feeling like, oh, okay, so maybe we can stay home for a while and then we'll just go back to normal. But that was because we didn't have much information. But now I can feel that people's tension is growing day by day because all the data and news comes from the United States, and so people started to really concern, but it's just not being reflected in our government's decisions yet.
So what do you think? What do they need to react? Is there a lot of pressure, or do you need, because if I suppose it will come if they don't do measurement.
Yeah, so people started to talk more about how it should be handled. But usually before, like in Japan, people don't like to talk about politics. But now I think more and more people are talking, and hopefully the government will come up with a better solution.
Yeah,
Yes.
I also was told that there was like that the prime minister, he sent an initiative to mask to each household, no, calling it
Yeah.
Abe no Masku, and his economic policy was Abenomics. Or so can you tell me something about this?
Have you read about the article about the masks?
Yeah, they told me. They told me.
Yes, I thought it was a April Fool's joke because it was on April 1st. He declared that he was going to send two masks a family, not even a person, a family. So like we have five people in our family. What I'm gonna do with two masks? April 1st. I mean, in Germany, uh, mm, pre- pre- president, not
Yeah.
president,
Der
uh,
Kanzler
Prime,
Bundes. Yeah.
Prime Minister Merkel was declaring, we are going to support you. And that was, I think, March 22nd or something. But our government, declared that they are going to support us with two masks. We're like, wow.
But the Japanese people, do they are they very quiet and don't protest, or sometimes they say okay, that's it, and then they
Yeah.
protest a lot.
Well, at that time, we couldn't stop laughing. Like we became, I think we everybody became really creative to come up with stupid jokes or pictures, drawings, and yeah, we were upset, but at the same time they were like, "Oh my God, I can't believe this is happening!" Really, you know what I mean?
Yeah. And my
Yeah.
question is, do you
So,
see some do you see some positive thing of this crisis?
yeah, that's the thing I've been thinking. When I saw Corona positive, so I was thinking, yeah, what could be, and then I thought, well, like a stay home action, right, it's really a good relief for, I think, students. Because normally, if you belong to some sports, like clubs, you get up like 5 something and then go to the morning practice. And they're so exhausted by the time they get home, right? But since they don't have schools or any other, activities, they're more, I don't know, spending time at their own pace and learning at their own pace. I think this is a good opportunity in a way.
And for you, and in a small flat with 3 kids, is it very
Mm-hmm.
peaceful? Is it? Do you see some positive thing of this?
Well, yeah, well, maybe first couple weeks, I found it was difficult because kids were like, getting up late and then come up, eat breakfast like 9, 10 o'clock. And then again, and while they're eating, they say, what's for lunch? What's for dinner? Yeah. So I was really exhausted and I didn't have my own pace. But now I think, they're more like, we have their pace every day. Is getting better, yes.
And do you feel some the positive for you something? You see more solidarity, or you see or something, or is it not positive in him?
Solidarity in the community, you mean, like?
Yeah, for example, if you see that there are more initiative and other people are helping more, or but
Yes, that's for sure. Yes, that is for sure. But at the same time, we see uh, divisions, gaps in between too. There are people really helpful, and there are people who are, I don't know, who think it is okay to,
yeah,
you know.
it was short. Is what cut? Yeah, people. Can you repeat it?
Mm. Yeah, some people are very becoming helpful, like, do more voluntarily helping others, and that is a good, you know, good outcome. But some people, uh, I don't know, some social expectation is maybe a little greater in Japan than countries individualism is established. So I don't know, good and bad. I cannot say well though.
So, but the one people, they are not. They are more in. You saying that they're more individual in Japan, or more used to be not such
Yeah,
so individual.
not so individual.
Ah, yeah, yeah. And now you need to be more individual in this crisis.
Exactly. We want to be part of the, you know, how do you say, decision making.
Yeah. And then now with
Yes,
the crisis, yeah, yeah, no, you need more like private
we
forces, no?
express. Yes, we as a citizen, we should express what we need and what is happening, what's not really, you know. We
Yeah,
need
yeah, yeah,
to, yeah, speak it loud.
yeah, yeah, yeah. I know, and this is what you need to do, no? Okay,
Mm.
Emika, thank you very much
Oh, thank you. Nice
for
talking.
yeah, and we will talk another time, yeah.
Sure. Yes.
And I tell you a little bit. Thank you very much.
Thank you so much. Nice talking to you, Katja.
Yeah.
Bye.
Bye bye. Bye.